Hi, my name is Ashley Johnson. I'm a family nurse practitioner student with Walden University, and this is my head-to-toe physical assessment. Over here I have my tools to use during my head-to-toe physical exam, and this is the handheld Snellen chart that I copied off of the computer for him to read. Can you state your name, place, and time?
Yes, RJ is my name. Kansas City, Kansas is where I reside, and today is February 7th, 2015.
Okay. Your speech is clear. It looks like I've got a well-developed 29-year-old white male. You're well-groomed, pleasant, alert and oriented ×3. I took a set of vital signs. His temperature was 98.6. His heart rate was 82. His respirations were 14. His blood pressure was 128/70. His height was 6'4". His weight was 300 pounds. And on a scale of 0 to 10 on a pain scale, what would you rate your pain? 0 being no pain, 10 being the worst pain.
0.
Okay, good. Okay, I'm just going to start by looking him over. His skin, I don't see any abnormalities, lesions, bruising, moles. I'm just going to feel. It's pink, dry, and warm. I'm just going to look at his head. It's normocephalic. The skin moves freely. I'm going to look at his neck. It's supple without masses or lesions. I'm going to palpate his thyroid. No nodules or enlargement noted. His trachea is midline. His eyes are symmetric with his ears. His facial symmetry is good. No trauma noted. I'm going to look at your eyes. The conjunctiva is pink and moist, no discharge noted. If I can have you cover one eye and gaze at something on the back wall.
Okay.
And then pull it away. And then with the other eye. Okay, no nystagmus noted. Okay, if you'll cover the same eye as I cover, and then tell me when you see something.
Okay. 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 Okay.
Okay, good. Okay, and then I'm just going to have you test your vision. If you could, hold this, whichever line is best for you, the 24-inch line?
Yeah.
Okay, if you'll hold it 24 inches and cover one eye and read to the best of your ability.
DZECLPTOF.
Okay, very good. And switch eyes.
DZECLPTOF.
Okay, good. So the 24-inch line, the line that he read, his vision would be 20/20. Okay, and then I'm just going to check your pupils. If you'll look at my nose. Okay, his pupils were 3 round and reactive perla. Okay, and then if you'll look at my pen, and if you'll follow. Good, okay, and now I'm just going to look in your eyes. Okay. Okay, his red reflex is detective, his optic disc is yellowish orange, and no aneurysms are seen. Okay, now this eye. Okay. His red reflex is detected, his optic disc is yellowish orange, and no aneurysms are seen. Okay, good. Okay. Okay, I'm going to test your hearing on your ears. If you could occlude one ear, and I'm going to whisper something and tell me what you hear.
Apples.
Good.
Oranges.
Good. Okay. I'm just going to look at your ears. They're symmetric to your face. I'm going to feel them. They're warm and dry and pink. No lesions or abnormalities seen. Now I'm just going to look in them. Okay, the tympanic membrane is seen. It's pearly gray and translucent, no bulging, no redness, and the cone of light is seen. Okay, and next. Okay, the tympanic membrane is seen. It's pearly gray and translucent, no bulging, no redness, and the cone of light is seen. Okay, and then I'm going to look at your nose. Just feel. Okay, no abnormalities felt. I'm going to look up in your nostrils. Okay, coarse hairs, no septum deviation, no discharge or drainage noted. Okay, no drainage or discharge noted, no redness, and both nostrils are patent. Okay. If I could have you close your eyes and include one nostril. You could tell me what you smell.
Alcohol.
Okay, and this is an alcohol pad. Very good. Okay, and then I'm going to look in your mouth. Okay, dentation is intact. Oral mucosa is pink and moist. His hard palate and soft palate are intact, no deformity noted. If you'll lift up your tongue. Okay, no lesions or sores noted. And then if you'll stick your tongue out and say ah. Okay, and his uvula is midline and his tonsils are +1, no exudate noted. Okay, good. Okay, and then I'm going to palpate your lymph nodes. Anterior, posterior, occipital, tonsillar, submental, supraclavicular, infraclavicular. Any tenderness with any of that?
No, ma'am.
Okay, and then I'm going to palpate your sinuses, their frontal, and your maxillary. Any
Nope.
tenderness with that?
Nope.
Okay, and then I'm going to test sensation on your face. If you'll close your eyes and tell me if you feel anything.
Yep. 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 Yep.
Okay, good. Okay, and then I'm going to have you shrug your shoulders.
Okay.
Just shrug your shoulders. And then if you'll push against mine. Okay, and then if I can have you smile and frown and raise your eyebrows. Okay, and then if you'll open and close your jaw. Open and close your jaw. Okay, and then close them and grit your teeth. Okay, good. Okay, and smile. Good. Okay, so I tested his cranial nerves. Cranial nerve number 1 was the smell that I tested. Cranial nerve number 2 was his visual acuity. Cranials 3, 4, and 5 were his peripheral vision. Cranial 6 was his hearing. Cranial 7 was his smiling and frowning and raising of the eyebrows. Cranial number 8 was his jaw clenching and the sensation of touch on his face. And cranial nerve number 9, 10, and 11 was him saying ah and sticking out his tongue. And cranial nerve number 12 was him shrugging his shoulders against resistance. Okay, and then if I can have you take off your shirt. Okay, and then I'm just going to look at his chest and look at his skin. It's warm, pink, and dry. I'm just going to palpate his chest. Okay, and I'm just going to look at his respirations. They're within normal limits. I'm going to test his chest expansion. If you'll take a deep breath and out. Good, and so his chest expansion was equal bilaterally. I'm going to listen to his breath sounds. Okay, and then I'm going to look at his back. Okay, and it's pink, warm, and dry. No abnormal lesions, deformities, or moles. I'm just going to palpate his chest, his back. Okay, nothing noted. I'm going to listen. If you'll take deep breaths, please. Okay, no adventitious sounds were noted, and breath sounds were clear. Okay, and now I'm going to feel your PMI. Okay, 1 to 2 centimeters in your pericardium. No thrills, pulsations, or lifts. Okay, now I'm going to listen to your heart. I'm sorry. Aortic, pulmonic, tricuspid, herbs, and mitral. And then I'm going to listen again with the bell of my stethoscope. Okay. Okay. Cardiac sounds were normal. No murmurs or bruits were heard. S2 is best heard over the base of the heart, and S1 over the apex of the heart. Okay. And then I'm going to feel for your carotid pulses. Okay, those are 2+. I'm going to look for any jugular vein distension if you'll turn your head. Okay, again. Okay, no jugular vein distension noted. I'm going to listen for any carotid bruits. You'll hold your breath. Okay, no carotid bruits were heard. Okay, if you'll come and lay down over here. Okay, I'm going to feel for your pulses, your brachial, 2+, your radial, 2+, 2+, and 2+. Okay, and your posterior tibialis, 2+, 2+, and the dorsalis pedis, 2+, 2+. And I don't see any edema or abnormality in his legs or extremities. His skin is warm and pink and dry. I'm going to look in his abdomen. It is flat and round. His umbilicus is inverted. I don't see any bulging or abnormality. I'm going to listen for vowel sounds. Okay, his vowel sounds were normal active times 4 quadrants. I'm going to percuss over his abdomen. Okay, and there's dullness heard over the liver and tympany throughout his abdomen, and that's normal. And now I'm just going to palpate. Tell me if you have any tenderness.
No.
Okay. Okay, no tenderness, and I don't feel any organ enlargement or deformities or any enlargements. Okay, if I can get you to sit up and come put your shirt back on, and if you'll sit down right over there. Okay, I'm just going to do your reflexes. If you'll just relax your arm. Okay, good. Okay, and your knee. Good. And then your ankle. Good. Okay. This side. Good. Good, okay. And then I'm just going to do your feet. Okay. And no toe flaring, so it's negative, which is normal in the adult. Okay, and then I'm just going to test the vibration on your extremities. If you'll tell me, close your eyes and tell me when you feel it.
Yes.
Okay,
Yes.
okay,
Yes. Yes.
okay, good. Okay, and then I'm going to test light sensation on your extremities. If you'll close your eyes and tell me when you see it. I'm sorry, when you feel it.
Yes. 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 Yes.
Okay, good. Good, okay. And then I'm going to test this graphesthesia. If you'll hand me your hand and close your eyes and tell me when you feel, or what you feel me drawing in your hand.
Well, a 3?
Yes, very good, okay. And then I'm going to have you put your head down to your chest and back and to the side and to the side and all the way over. Both sides, good, okay, and then your arms all the way up and out and back, okay, and then forward, and then I'm gonna have you push against me, good, in, up, down, good, okay, and the same with your legs, if you'll put them out, in, up, down, good, and then if you'll stand up, bend all the way down at your knees, good, and then if you'll walk, good. Your posture is steady, your gait is normal, and your posture is upright. Good. Okay? And then I'm going to have you bend down at your waist, yes. Okay, up. And then if you'll twist, and then both sides, yes, very good. And then all the way over, all the way over. Good. Okay, and then if I can have you do if you'll close your eyes, put your hands out, and if you'll touch your finger to your nose and the next, and then do it fast, back and forth. Good, very good, okay? And if I can have you put your feet together, close your eyes. Okay, good. The Romberg is negative, okay? And then if I can have you turn around and pull up your shirt, I'm gonna look at your back. Okay, it's pink, white, dry, and warm. And then I'm just gonna palpate your spine. Okay, and then have you bend over. I'm going to palpate. Okay, no swelling, redness, nodules, any deformities noted, none. Okay, if you'll sit back up, it's convex, concave, and then convex, and that's normal. Okay, and I think that this concludes our head to toe physical exam. Thank you so much for being my patient today.